Hi, I'm Noor Kapoor. Why would you want to lie in pain when you know there's nothing more to look forward to? Why would you want to suffer when you know the end is near? What if you or a loved one is diagnosed with a terminal illness and has unbearable pain? Wouldn't you want to end that suffering? Anyone would want to. Everyone hopes to have a peaceful death with no suffering and no pain. Therefore, I believe that physician-assisted suicide should be legalized in many more states today. Physician-assisted suicide is the painless killing of patients who are suffering from incurable and painful diseases or even irreversible comas. I believe that patients should be allowed the freedom of choice to choose this as an option. I am here today to persuade you that physician-assisted suicide should be legalized in many more states today. And I'll tell you why this is important by explaining why the relief of pain is necessary, the economic factors involved, and the freedom of choice, and also the states that legalize physician-assisted suicide today. First off, I do want to talk about the difference between physician-assisted suicide and euthanasia. Physician-assisted suicide is when a person who dies performs the last act. An example of this would be if a patient swallows an overdose of drugs that the doctor has provided for the patient. Another example would be if a patient pushes a switch to trigger a lethal injection in them only after the doctor has inserted the needle in their vein. On the other hand, euthanasia is when the third party performs the last act. An example would be giving the patient a lethal injection or even suffocating the patient to its death. Physician-assisted suicide needs to be legal in more states today, and this gives the patients the opportunity to escape pain and die with dignity. Everyone hopes to have a peaceful death, without pain, without any suffering. So why should patients suffer? Okay, patients suffering from an incurable or a painful disease or even an irreversible coma has the right of choice, an option to choose physician-assisted suicide. This option will also allow them the peace of mind. Alongside it, physician-assisted suicide has many economic factors that are very beneficial for the economy. By allowing physician-assisted suicide, we can save the money that it takes to keep a patient in a hospital and use it towards research and on medicine for patients who are able to be cured. The famous case of Nancy Cruzon in Missouri and Fred Rosner stated in his article, Death by Withdrawal of Nutrition and Hydration, mentioned that Missouri was actually suffering, and they were suffering because it took them $22,000 a year to keep Nancy in the hospital. In situations like Nancy, we can save thousands of dollars by providing the choice of physician-assisted suicide. In addition, that physician-assisted suicide clearly emphasizes the importance of relieving pain and the economic benefits of the economy. Physician-assisted suicide also gives the freedom of choice to patients. It is important to acknowledge that a person has the right to choose how he or she can live or die. The possibility of escape is extremely important, so the presence of a prescription or the promise to provide one in the future can be important comfort in itself that may never be activated. And this was said by Timothy E. Quill in his article, Physicians Should Assist in Suicide When It Is Appropriate. Some think that patients would abuse the option of having physician-assisted suicide, but in reality, this is just a really good option for patients who are suffering from pain. In the end, patients do have the freedom of choice over their life. Lastly, I'm going to talk about the 4 states that legalize physician-assisted suicide. According to ProCon, in this article, State-by-State Guide to Physician-Assisted Suicide, there are currently 4 states that have legalized this: Oregon, Washington, Montana, and Vermont. 3 of these states have legalized it through legislation, which is Oregon, Washington, and Vermont. 1 state has legalized it through court ruling, and that's Montana. Oregon legalized physician-assisted suicide on November 8, 1994. Washington did on November 4, 2008. Montana did December 31, 2009. And Vermont did on May 20, 2013, being the most recent state. Physician-assisted suicide can help patients who are in a vegetable state, a coma, or even have a terminal illness, and when they know the end is near. Not only does this help the patient, but this also helps the economy. By doing this, you're also giving the patient their right of freedom of choice to decide over their life. Although physician-assisted suicide is a very controversial topic and affects many people's viewpoint, it is a subject that needs to be addressed today. It is very important that states start to recognize the importance of giving this option to patients who are suffering. Physician-assisted suicide can help end painful feelings, it's economically beneficial, and gives patients the freedom of choice. It is time that patients are able to choose how they live and how they die. It is time that their voices are heard. Thank you.